Hi guys, it's Teresa, Senior Occupational Therapist here. The question that everybody's after is what is the difference between occupational health and occupational therapy? And I am here to answer that question. As I am an occupational therapist is a professional that works together with a patient to help achieve their goals in relation to their activities of daily living and their meaningful occupations. Occupations does not necessarily mean a job, it means that something that is quite important to an individual. An occupation may mean that, for example, cooking, there were previously used to be a chef, that is their occupation. I mean, that's a job as well, but it's meaningful to them. They might say that cooking is quite meaningful to them. An occupation could also be brushing their teeth in the morning. So if a individual has lost all of their abilities to pick up their toothbrush and brush their teeth due to physical changes and mental changes post having a brain-related injury, occupational therapists are there to ensure that they are able to return back to, being able to pick up that toothbrush again and brushing their teeth and engaging in that meaningful occupation. That meaningful occupation might bring an individual great sense of joy, relief, and belonging. Occupational health, they enable individuals, not necessarily patients, achieve their well-being and productivity in regards to a workplace environment. Occupational health look at whether an individual is fit to return back to work after having an injury, after having an accident. Occupational health professionals are essentially there to ensure an individual is fit to return back to work. So they may look at fitness to practice, they may look at the environment in which an individual works in, they may adapt certain things that an individual requires to be able to functionally complete their task at work. That might mean the chair that they sit on, that might mean the screen that they looking at the different types of heights of the screen, and ensuring that they are not at strain of, being further injured in the workplace. Occupational health also look at individuals' mental well-being. So it's not just regarding their functional abilities, it's also whether an individual is mentally sane to be able to complete their everyday tasks at work, being able to see whether they are able to, carry out their jobs and their roles in the workplace. Occupational health professionals also look at how safe a work environment is for an individual who has previously had the history of a particular illness that might affect, if an individual works in an environment where there is, constant fumes around the environment, and the individual is suffering from, asthma attacks, the individual is suffering from, breathing issues, the occupational health practitioner will complete those relevant assessments to see whether an individual is fit to return back to that working environment. And it's a matter of seeing whether they may require a particular mask to go into their working environment to see whether they are actually appropriate to return back to that environment, and seeing what the individual triggers are. For example, if there are constant fumes in the environment, what type of fume is it, and what exactly about the fumes is triggering the asthma attack. So there are nurses, there are doctors that work within the occupational health department that they will be able to complete the relevant assessments to see whether that individual is fit to return back to work. Whereas an occupational therapist looks at a patient's leisure activities, their productivity activities, what makes them an individual. So it's all about what makes them a being, what makes them an individual being in order to complete their activities of daily living. Activities of daily living could mean anything to an individual. So it may mean that first thing in the morning, they like to have a shower, have a bath, wash their hair, the ability to be able to do that. As an occupational therapist, we work with patients who might have been impacted by a certain disability, illness, all sorts of things. So it's a matter of just seeing whether patients are able to be supported within that transition of when they first had that accident to now being from being that individual that they were before the accident to now the individual that they are after the accident. So it's being able to pick the things out of what they were as a patient, not necessarily a patient, as an individual before, what their likes and desires were before they had the accident, to now bringing that forth to their goals and making sure that those are the patient's goals after they had that accident. Those goals might mean that before they had that accident that they enjoyed playing golf, but now because they've had the accident, they are unable to return back to playing golf. But that doesn't necessarily mean that they will never go back to playing golf again. It just might mean that we are ensuring that we have developed goals together, goals that are specific, goals that are measurable, goals that are achievable to the patient, goals that are realistic, and goals that are timely to the patient as well. So we work together with the patient to come up with SMART goals, as I've just mentioned what it means, to help achieve that goal of being able to return back to playing golf again. That necessarily may mean that playing golf might be a long-term goal for that patient, but we as occupational therapists can break it down into smaller goals. And those goals might look like being able to, have that lower limb strength to be able to stand up straight and, be able to have the stance that people that play golf are able to have, being able to have that upper limb strength to be able to hold, what do you call the thing? A club, to being able to hold a club. And then being able to see whether they have, defined motor skills to be able to hold that club and to be able to have that coordination to swing their upper limb to be able to throw the golf ball. Yeah, so as an occupational therapist, we are there to ensure that patients are not just looked at as patients, but they are looked at as individuals who once had a desire and a dream. Those dreams might be a long-term dream for the patients, but we are there to be able to chunk that dream and work towards achieving that dream in the long run. I hope that provides you the answer of what is the difference between occupational health versus occupational therapy. And I hope now you guys don't confuse an occupational therapist for an occupational health professional. Thank you. Bye.